COVID rapidly spreading here in the U.S. again, some calling this a tripledemic, noting that COVID, RSV, and flu cases are all on the rise. And this current season of illness already competes with some of the worst cold and flu seasons in history, also reportedly starting 2 months earlier than normal. Joining us now for a look at how the tripledemic is impacting us this holiday season, Dr. Casey Bleasdale, the Chief Quality Officer for the University of Illinois Hospital and Health Sciences System. Thank you so much for being here.
Thanks for having me.
What are you tracking right now in terms of the tripledemic? How bad is it? Have we peaked? And what is the outlook?
Well, as you mentioned, there are three. So it's the COVID-19 virus, it is influenza, and then we've been struggling also with something called respiratory syncytial virus, which is a virus that can affect everyone, but is very significant for the very young, and it can be for the very old. We have really seen things start to increase after the Thanksgiving holiday. We may start to see a plateau, but we know we're heading into the holidays in a week for many that celebrate Christmas. And what we saw last year, unfortunately, is people gathering and a lot of transmission around the holidays. So we anticipate that those numbers are going to go up in the next week to 2 weeks. And it's really important for us to try to do what we can to prevent cases so that our hospitals are not overwhelmed and so that we can protect people from severe illness.
And we know influenza normally peaks in February, but it's driven up hospitalization to the highest level for this time of year in more than a decade, surpassing hospitalizations for COVID. How concerned should we be about influenza? Out of the three, is that the one that you're really concerned about right now?
Well, I think it is important because it is higher than what we have seen in several years. We really had no flu in the past few years because of wearing masks. I think it's important that we're paying attention to it and that we know what is helpful and not going to events or work or school when you are sick. Wearing masks help to prevent transmission of influenza and COVID-19 and RSV. And this is important because with these numbers being so high and COVID-19 is still present, and we're seeing those numbers go up again, that we are concerned because the more people that are affected by this, our capacities are challenged, and it's hard to take care of people if we have so many people ill and needing to be hospitalized. So use caution before gathering for the holidays.
With the way things are tracking and trending, do you anticipate lockdowns or mask mandates will be making a comeback at any point soon?
I don't think that we're going to get to the point of lockdowns, but we need to remember what works. We want to make sure that people get vaccinated for influenza. That's something that we've known for years, that influenza vaccination helps to prevent severe illness. It doesn't prevent acquiring it, but it does prevent severe illness. So it's important to get your flu shot. Get your flu shot soon. It takes at least 2 weeks, similar to the COVID-19 vaccines, to be protected from the vaccine. Get vaccinated for the COVID-19 current bivalent vaccine that is available. It may not be as effective against the current strains, but will likely protect against severe disease and hospitalization. And the thing, again, we know that not interacting with others when you are ill, not going again to work or school or gathering when you have symptoms of a cold, a respiratory virus, that's going to help to protect people through the holidays, and along with vaccination. And then, of course, treatment. We've been struggling. There has been a shortage of treatment for influenza. It's called oseltamivir. We're starting to see more availability of that. And then we also have our treatments for COVID-19, the oral treatment. Unfortunately, the new strains are not responding to some of the injection medications that we've had for COVID-19. So it's really important that if you get an infection, a respiratory virus, you see your doctor, you get tested for various respiratory viruses, and you see if you would be a candidate for treatment. This will help us to get through this holiday respiratory season.
I appreciate that, and I hadn't heard some of that information before. Dr. Casey Bleasdale, thank you so much for your time tonight.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.